Hello everyone, today we are going to have a look at retained placenta, and this comes under complications of third stage of labor. Let us first see the definition here. According to WHO, the placenta is said to be retained when it is not expelled out even 30 minutes after the birth of the baby. So if you remember the third stage of labor, it is characterized by the expulsion of the placenta. So if the placenta, if it is not expelled within 30 minutes after the delivery of the baby, then the placenta is said to be retained. Now let us see the causes of this retained placenta. In the normal expulsion of placenta, there are three phases. First, separation through the spongy layer of the decidua, meaning that the placenta, it gets separated from the uterus. Descent into the lower segment and the vagina. So the placenta, it gets descended into the lower segment and to the vagina, and finally its expulsion occurs to the outside world. Any interference to the physiological processes which was mentioned, it will result in retained placenta. So first off, we have placenta completely separated but retained, that is due to poor voluntary expulsive efforts. So this means that if the placenta is completely separated from the uterus, but still it is retained and not yet expelled out, then it is due to the poor voluntary expulsive efforts of the mother, meaning that the mother's expulsive efforts is not enough to expel the placenta out into the world. Simple adherent placenta due to uterine atonicity. So this means that the placenta, it gets adhered to the uterus mainly due to the poor contraction of the uterus. And this is mainly seen in cases of grand multipara, overdistension of uterus, prolonged labor and uterine malformation, or due to bigger placental surface area. The commonest cause of the retention of non-separated placenta is atonic uterus, morbid adherent placenta, partial or rarely complete. So this means that the placenta is morbidly attached to the uterus, that any attempt to remove it may result in severe postpartum hemorrhage. Placenta incarcerated following partial or complete separation due to constriction ring, premature attempts to deliver placenta before it is separated. So placenta incarcerated simply means that the placenta has been completely separated from the uterus, but still it is retained inside because of the abnormal implantation to the basal disc. Now moving on to the diagnosis. The diagnosis of retained placenta is made by an arbitrary time of 15 minutes spent following delivery of the baby. Here, the features of placental separation are assessed. So this can be done per abdomen as well as per vaginum. And per abdomen, the uterus becomes globular, firm, and bilutable. The fundal height is slightly raised, and slight bulging in the suprapubic region will be there. Per vaginum, there will be slight gush of vaginal bleeding as well as permanent lengthening of the cord is established. The hourglass contraction, or the nature of the adherent placenta, which I've mentioned before, which was simple or morbid adherent placenta, they can only be diagnosed during the manual removal of the placenta. So there are certain risks which are involved in prolonged retention of placenta. There are 4 points here. First, we have hemorrhage. Hemorrhage meaning that bleeding may occur. Shock can also occur as a result of blood loss, but at times it may also be unrelated to blood loss. It can also occur as a result of the prolonged retention of placenta. And puerperal sepsis, which basically means postpartum infections, can also occur, and the risk of its recurrence in the next pregnancy is also quite high. Now moving on to the management. Period of watchful expectancy. So during the arbitrary time limit of half an hour, so the patient is watched carefully for evidence of any bleeding revealed or concealed. So in revealed, the bleeding will flow from the placental separation to the cervix, and in concealed, the bleeding will occur within the uterus. And to know the signs of separation of placenta. So the signs, I've mentioned it before. The bladder should be emptied using a rubber catheter, and any bleeding during the period should be managed as outlined in the third stage of bleeding. If the placenta is separated and retained, then the placenta is taken out by using controlled cord traction. But in the case of unseparated retained placenta, then manual removal of the placenta is to be done under general anesthesia.